So we got it and we started using it. Definitely a learning curve. Takes a little time for the doctor, and as far as, I mean, it really makes you prep better, or be a little more cautious anyway. But things like that, the design of it is I really like the way machine does it, and then it's got so many different ways to change it up. Y'all know that. Having two assistants, so she can be working on it while we're working on another patient, and that's kind of a key to the I'll say profitability of it. I mean, if you're the doctor, I went to some other seminar, mini implants or something, and been on the break. You hear the doctors talking about, well, I stayed during lunch and I was working on there, or I stayed after work and I was working on this. And, I said, that's not what I wanted for. And so I said, that's not going to work if that's going to be the case. So you really have to get your staff involved. And she'll call me when she needs to check something or check the margins. I kind of check that off, and then she'll design it, and I'll come back and look at that and check that off before she sends it to the mill and everything. So some people said, well, it's good to have a temporary on there for a couple of weeks, kind of let you know if the tooth is going to be okay, or whether it's going to be sensitive, or something like that. But the ones we've done, I haven't had any issues with. That hasn't been an issue. But now, even since then, I've done it more for even second molars, things like that, because sometimes you can't get the camera in there, so you have to take an impression. You can do it off the impression, or you can pull it up real quick. Well, I was going to England the last couple of weeks, and so I was trying to get anybody that needed a crown. I didn't want them to be wearing a temporary while I was gone, so I kind of said, well, let's just take an impression, pull up the model, do it. And so we've been doing a lot of them that way, if we need to in a hurry or in a crunch, something like that. And we did one yesterday. We actually could not. It was a bicuspid, and sometimes they're hard because you got the incisors are higher, and it's just hard. But she also had a lot of fleshy gum tissue around the tongue and both sides. And I mean, we took pictures 3 times and just could not get the lingual. And so we said, well, let's take an impression. So we took an impression and just made it right there, Empress Crown, while she waited. It was just a little longer, not much. So, so it's just real versatile in that. It's just so convenient for the patient not to have to wear a temporary for so long. That hasn't been an issue. Hadn't been any more, probably less teeth with root canals afterwards than before. Less sensitivity, less complaints, less phone calls. The temporaries come off. So overall, it's just been, and I'm kind of like somebody likes to sit down, get something, do it, get it done, get it finished, and that's kind of the way this is. You prep it, and scan it, get it made, and get it seated, and it's kind of done. And the patients love walking out, not having to worry about what to eat or what not to eat, or floss or brush, things like that. So it's really a patient pleaser in that aspect. It's convenient for them, and they don't seem to mind waiting, a couple hours if that's what it takes.